Good afternoon, everyone. Welcome to Endocrine Grand Rounds for this week. We are very happy to have Dr. Liu Kai from the Department of Pediatrics. He's the director of the Pediatric Research Institute. He's professor in the Department of Pharmacology, in the Department of Pediatrics, and also in Pharmacology and Toxicology at UofL. Many of you have heard him before. I think it's fourth or fifth time that he's giving a presentation to us here in different topics related to metabolic disorders and related issues. So, today he'll be talking about environmental exposure to cadmium and potentially increased risk of cancer. Thank you.
Thank you so much for your nice introduction, even short, but thank you. Yeah, I will come here and have a presentation for several times, and today I'm really happy to share some my progress, kind of progression and some new direction, and because it's endocrinology, so I bring some cadmium that is kind of an endocrine disruptor, so that is probably some interest. So today's topic is cadmium and probably increase some cancer risk. And I do not have any complete interest. And this is a slide to try to outline what I will talk today. And so basically I will briefly introduce the cadmium and then to talk about the two model, how we use the two model to look for the potential risk for the cadmium induced for cancer. So we are all work on the different group, different department, but we work on the human disease, and we know a lot of epidemiology and the study indicators cancer, cardiovascular disease, and that is a kind of increase with globals. But the always is try to use big data. The more and the population, the big data, big numbers to try to convince the people they have the link. But actually, when we look for the detail for even for the United States, in nationwide, cancer is very high, and for example, 20%, for example, like that. But when we look for the state by state, that is totally different. Some state is very high and some state is low. And you can see here is an example. This is in 1999. And look for the new cancer case. And Kentucky and is in the one of the top of the state, compare the average and nationwide informations. So that is really show your geographic difference and the different kind of the environment part of different population have the different prevalence for the cancers. What's going on for the difference? That a lot of the factor affect, and your lifestyle, your genetic, and your the Medicare, the policy, a lot of the information or factor affect this cause the difference. But after we realize that high prevalence, we try to nationwide or global have the education and how to prevent cancer, and you can see that 10 years later, and some state and they change and improved. For example, last slide, this is very dark, and this one's very dark. But some state change, but Kentucky and with other state not change, still keep a very high top. And another 10 years and passed, and you see that 20 years later, and still Kentucky or a couple of the other states still very high. And even the most recently, they have 2020s, and the Kentucky really high. So that is that is not all genetic information probably, and not the lifestyle or policy and the education level. They have some kind of the factor not easier to modify it. So we think probably that is something, and more and knowledge and more evidence showing the environmental really is a big factor affect the different kind of chronic disease, and cancer is one of that. So when we look for the EPA and they talk about the environmental and with the human health, and they talk about the air pollution and water contamination and the land as a situation, but the air, the water, the where deposit is at environmental in the soil. So that is really makes the environmental is a big concern for the our health, and that is not day one day you can change the environment. You have to long term and to process. So when they look for the our blood, human blood, and you can see the indicator and heavy metal or cadmium, lead, and mercury really is some indicator and showing the increase in kind of affect our bodies. So NIHS, and that is an NIH environmental institute. They try to work on the environmental and health, and they talk about the new concept, exposome. And what it means exposome, before we just talk about one dose or mostly use adults and individual or animal to do the study for the exposure, the toxicology, or what to check. But actually right now is for human life or health, they need to talk about the whole life stage, not just a one-time part. That is your you miss a lot of the information per stage for the environmental impact for human health. So because I talk about the cadmium, and the cadmium belong to one metals, probably briefly overview what kind of metal and what we need and what is toxic. So when we talk about metal, that supposed to have first concept, the metal, some is essential, some is not essential, right? And the zinc, iron, that is our body is essential. We have to have that. But kind of cadmium, mercury, we don't need that, not at all. And so zinc and iron is you have to have that. That not means when you have blood, have zinc, your copper, and iron that is toxic, cause disease. But if the mercury or cadmium, if you have some levels that have certain risk, so that is we need to think about it. What is essential and what is non-essential? What is a heavy metal and a non-heavy metal? Probably when we read the literature, we hear about that concept. That is based on molecular size and weight. So that is is not either necessary or toxic or not toxic. And actually, more and more, and they probably will ignore that heavy metals concept. They talk about a transitional metal or essential metal. Transition metal is a chemical feature, and some metal very active and from violent to 2 and oxidize reduced. So last year, and we talked about a hypertension with pulmonary hypertension with metal, and I summarized the metal and use this table, and you can see this column, and that is an essential metal, and total about 10. And actually, it's a lot of the previous work, and even right now they still think about the chromium, especially the 3, that is the kind of the trace element and with essential element. But more and we realize that chromium also is very toxic and cause a lot of problem. And actually, not that many, we didn't have some enzyme specifically needed this iron, these metals. So this code belong to that group, non-essential metals. And based on this concept and the 5 gram, and that is the size, and that is a column is a cut is a heavy metal. So this belongs to this level, and that is called the heavy metal. Heavy metal includes the essential metal and non-essential metal. And I use the red font and indicate which metals they call the transition metals. So that means a very actively copper, and that were actively from 3 to 2 or 2 to 1. So that called a fountain reaction generates a lot of free radicals. So after we learned that, so we can go to our project. And so first project model, we use adult exposure to low dose cadmium. So and Dr. Burwang, and that is a long time ago, about 10 years ago, and more than that, because that is published, and come here and start work on the cadmium, and we try to link the smoker, heavy smoker. So we use a very low dose cadmium to treat the rats. So that is about 2.3 ppm and 20 nanogram and kilogram of body weight. So we use the IP injection, give the a 4 weeks treatment. that is like a very low dose, and so then we stop. We know if we immediately check, they don't have any toxic effect. So we let them to survive to see what is the chronic later effects. That is more important, not just 24 hours and you talk, oh, this is how apoptotic cell death and that not. But this level is, we want to look for the like a environmental long-term exposure effect. So we keep them and 20 weeks and until like a 52 weeks to see what's going on. And we collect the kidney. Today we predominantly talk about the kidney, and we also collect the liver and talk about a little bit in here, but not other organ today. So we collect the kidney and to measure the ketamine, and you can see that the ketamine treatment group, this control, the age match control, you can see that is, and the ketamine actually very low and like nature white type and without treatment, you can see, and from 20 weeks old and after treatment, and that you can see the keep consistent, very small increase. That based on like probably the animal diet, or what are say some very minor contamination in our environment. But you can see the treatment even at 20 weeks after treatment, you can see that is a huge increase, but they reduced slowly until the 52 weeks and still very high. So that means the ketamine once go to our bodies, they stay there for a long time, and 30 years, 40 years, 60 years, something like that. So that like a kind of is in kidney keep a very long term, and that kidney like a ketamine increased and also affect the other like trace element. For like example, zinc, and you can see this ketamine treatment group. This is normal zinc levels, and at 20 weeks after treatment, zinc level is significantly lower than the control. And when we stop that, and the time like time being, and like you can see that a little bit slowly recover the control level, but very late catch up the normal levels. And the copper, same thing, and that cause copper and increase and higher and until very long term and even increased. And is a calcium also affect significantly reduced calcium concentration. So that we will know that why we are our bone cause a problem if ketamine contamination, and that is later catch up and further increased. So that is the trace element to change affected by the ketamine. When we look for the kidney function, but you see even long term not that much change, and occasionally in the one-time point they have a little increase and BUN in the urine, and that the creatinine not that remarkable like a change, but and when we look for morphology, and you didn't see like very messed up, but you can see the structure, but they have some necrosis and they have the cell regeneration like a phenomena. So that is very mild. And when we look for the antioxidant levels or oxidative stress and the lipid peroxidation and the control and the ketamine group, not that significant change. But SOD at a later stage and significantly lower and compared to control, and the GSH and the other the protein or antioxidant and not that much change, but like SOD decreased. And we know mito and like induce some methylcyanine, that is one protein I'm interested, and that is like when your body have a mito and that induce that protein and increased, and normally. And the methylcyanine and increase a little bit, and when you become aging, because you have more opportunity to exposure a different kind of stress. So methylcyanine increase kind of as a compensative and mechanism. But ketamine treatment and no, and actually is decreased and do not have shown that pattern. And when we look for the cells proliferation and marker, and actually we can see at the beginning, and the kind of is a surprise the cell proliferate, but a later stage that keep the cells proliferate and compare to control. And so that is like a very mild pathology and even not that significant like a biochemical levels damage. And but we found that is a kind of some necrosis small and later and the cell proliferate. So that is a kind of mild. That is didn't show the significant pathological or and the change. So we also look for the liver to see what is the different organ in fact. And we also see the same pattern, the cadmium significantly increased. But you can see in the liver, different organs really show the different pattern. They quickly eliminated the cadmium from liver to and the almost close with control. Not like a cadmium still huge, higher compared to control. And the zinc level quickly catch up to the normal level. So that really shows the different organs, like different patterns. What else? And we also found the increase of the hepatic lipid peroxidation and also see the liver inflammation, and same thing reduce the antioxidant level, SOD or metrocyanin, and that also increase like cell proliferation in the livers. And more interesting, we found they have a DNA damage, that they have less apoptotic cell death. So that is very interesting. And you see, if our body and usually they have some stress cause DNA damage, that turn our body and apoptotic cells pathway. That is make the cells with a bad genomic, they eliminate that. That is a kind of prevent the cancers. And this is a pathway turned like a TNF alpha pathway. But we found, and that is actually the low dose cadmium and has like a hypo reduce the like a methylation level for the TNF alpha promoter. So the hypomethylation usually is makes the gene is like a promoter is open, transfer factor easier to work on, so make the more generation for the TNF alpha. And meanwhile, and show the higher methylation and make that is condense the promoter part. That means transfer factor come and cannot make the downstream gene expression, transcription. So that is make the caspase-8 reduced expression. So that means in the pathway, cell death pathway is broken. Then the upstreams keep like increase, but downstream is keep decreased. So, but in this situation, if our body have DNA damage, but you have less apoptotic pathway, and you also have a chronic proliferate cells, that is actually is increase the cancer risk. So that is very dangerous. So in order to answer that, is check that we use use mouse model to do the repeat experiment again, but this time we use a methylation inhibitor control and also cadmium plus methylation inhibitor to see if we inhibit the methylation, what's going on. So actually we found, and after chronic cadmium treatment, low dose cadmium, and that liver shown like aberrant and global DNA methylation, and also persistent increased cell proliferation shown the steatosis and neoplasia. So that kind of the cells proliferation. And meanwhile, that when we give the methylation inhibitor, that prevent this phenomenon. And so that is we make the conclusion: the cadmium cause the methylation increased. Really is the like a mechanism, and make that is like cadmium causes the proliferation, shut down the apoptotic cell death. So that is really is a high risk for the cancer. Even we didn't see the cancer in that model. So after we learned that and got a couple of the idea, and we started to the second model. So the second model, you will see, really see the cancer part. And what is second model? So second model, we're not focused on the adult stage. Probably that is a more strong and have a more defense systems. So we give the prenatal exposure cadmium. So give the mom and the F0 generation and the low dose cadmium treatment, 5 ppm, and control and cadmium. And then we let the female mice breeding with the male without cadmium treatment. And that is and during their breeding and they're pregnant, and then they have the pups F1, and until the weaning, and because the pups they have to have milk from mom that causes cadmium. So that is called the prenatal and the low dose cadmium treatment. And then we gave the high-fat diet. That is called HCC induced diet. And meanwhile, we have the DN and the combined diet. That is a traditional and used induced HCC models. And so this will compare that we use the mom without any ketamine treatment, and the control and HCC diet treatment, and another group have the mom have the ketamine treatment, and also got the same diet to see compare these two groups, which one have more cancer formations. So this is the general information for the body weight, and you can see that's control, and this HCC diet and HCC diet plus the ketamine treatment. So that is the body weight significantly increased, and the increase more severe in the female and compare male. And when we look for the insulin resistant metabolic syndrome part, and we see the male is both high-fat diet cause the same problem, but in the female, and they have a synergy in fact. So this from this part, they already shown the gender difference, and for the ketamine from the high-fat diet. But we don't know when the cancer were forming and in the liver, so we sacrifice either the kind we call the early stage after treatment with the age is 26 weeks and old, and we sacrifice 3 from each group, and the male and the female. And this control no liver cancer, of course. But this is a high-fat diet standard fight to induce HCC. And you can see in this group, and only have HCC have two of 3 have the development of liver cancer. But this group and 100%, all the 3 development liver cancers. And for female and this group, no, but with the ketamine treatment, at least have 1 develop cancer. So when we learned that is developed very fast, so we were just sacrifice all the animals and 3 weeks later, and you can see this already fully developed cancer and 7 to 7 and 7 to 7. So that is a male, but in the female still 50% and developing liver cancer. So that is really shown the difference, but we feel the time is too late, but it's very pity, but we will continue work this part. So this gave you the idea. You can see what kind of the nodule in the liver cancer, and this front, and this back, and you can see this is HCC induced, and significantly less the nodule compare this and both sides. And when we look for the male, and you can see that is control, no any tumors, and no tumor number also is not 0, and you can see that even 7 all the animals developing the liver cancer, but the liver nodule significantly less, 5 to 15, and even 16 or 18. But in the another one with the ketamine treatment group, you can see that from 10 to more than about 30. So that is not even the case frequency is the same because too late stage, but the tumors status, number, and the size are different. And if you look for the size, you can see from small and to the gradually larger, and you can see these 2 groups have a significant difference. So this is AFP, that is kind of the HCC marker, and as you can see that the marker is significant, shown up. So that model really shown and pre-ketamine treatment and really enhance the offspring have the sensitivity to second hit cause the liver cancer. So we also want to look for the other organs, and that is HCC diet. We know that it induces liver cancer, but for the other, we don't know which one is the specific hepatitis induces the kidney cancer. So this one we want to look for the kidney. So we just give you the a general and hepatitis treatment, and this is a mom and pre-treatment, and the breeding, and they call it pregnant and have a birth, and the milk give the have the hepatitis and give the ketamine treatment, and that is you see. And when they weaning, so we separate the offspring, the pups, and one group have hepatitis, one group not hepatitis. So that it means they have a hepatitis or without hepatitis, and they also give the low dose ketamine treatment in the drinking water. We want to look for whole life, like the NIH suggests, like old stage. So we at 6 months, and we look for the kidney functions. And this is this is no high-fat diet. Just look for the cadmium treatment, 0.5 ppm, 5 ppm, and only 5 ppm that long, 6 months, and cause a little bit like a urine protein albumin increase, and the kidneys weight not checked. But you can see the second hit. Like upstream have the high-fat diet treatment for 6 months, and the urine protein is significantly increased even without pre-cadmium treatment. But with cadmium pre-treatment, the low dose and the high-fat dose significantly different. The high dose of 5 ppm synergic and increase the high-fat diet cause the kidney dysfunction. But the low dose one and reduce that, not a synergic increased, actually reduce the level. And the kidney like weight, and also inflammation part, TNF alpha, P and 38, you can see the high-fat diet significantly increased, and if the high-fat diet plus cadmium, the synergic increase, but not low cadmium group. So that is the inflammation, that is cell death pathway, and the same thing, and the high-fat diet causes cell death increased in the kidney, and the high cadmium group plus the high-fat diet have synergic effects, but not a low dose cadmium group. So what we learned from the this second model in the kidney, and we found the high-fat diet 6 months significantly increased the renal damage, mainly shown the apoptotic cell death and the inflammation, and high dose cadmium also can enhance the that is the high-fat diet caused effect. So we can call that synergic effects, but not a low dose cadmium, and because the low dose cadmium reduces the high-fat diet effects. So that is a very interesting. Simply, we can say, oh, low dose cadmium and can protect your kidney, but actually we don't think in that way, because that only reduces cell death pathway. And so is that really good? And so next, we hypothesize that this is like makes cell death less, and probably is not good things. And the high dose that is really causes the synergic toxic effect. But for the second cancer risk, probably the low cell death path, the phenotype, probably is not good. So that is our new hypothesis. But so far we haven't have the budget to do the animal models. But from the literature, and I collect and really support our idea, and we try to the next part, and we will do that. So you can see the renal cell carcinoma, and from the literature, they have very a review or a publication that linked to the environmental exposure for the renal cancers. And they talk about the genetic and also obese and smoke and several variable and variable or lifestyle. But finally they said the environmental is very important for the outcome. And several other reviews they said, and from the diet, lifestyle, what is a vegetable you eat, and how that is really can affect your instance for the renal cancer. So that means the environmental factor and your dietary factor really some factor affect the renal cancer and the sensitivity. And for smoker, and they further and have the idea and for the smoking, and that is really the major factor. And you can see this is a big review, and they summarize all the case. And lately they found the tobacco and the obese is top two factor increase risk of the renal cancers. And this is the published in 2021, and this is published in the JCI. It's a very good journal. They do the multiple omics, and they also do metabolomic. They look for all the kind of metals. They do the transcription level, and they finally narrow down. That is cause the glucose metabolism wrong, and they focus on from the smoker, they narrow down to arsenic and cadmium. That is smoking, and that is majorly through the cadmium or arsenic causes the metabolism, the pathway wrong, and causes methylation, and so that is the mechanism to involve that. So that really shown that like a metal and is a problem, even like smoking, and that also includes some chemicals. But GCI publication paper is narrowed down to metal. It's not like nicotine or other compounds. So that has really shown that metal and have the issue, the most important. So this one give you more like a direct evidence. So they collected the 76 and renal carcinoma cases of tissues, and with the 64 control tissues. And when they look for the metal, they also found the arsenic and kidney, arsenic and several metal increased. But you can see even arsenic just marginally and just reached to the significant difference. But you can see the cadmium is a remarkable and significantly related to the RCC. So that is from the patient, the tissues also shown the cadmium really high in that. So that is a cadmium increased and the antioxidant component decreased. So our own study, we found the cancer and in the liver increase risk is by cadmium. That is due to the methylation epigenetics. That the new study and talk about the kidney and cancer, they also talk about the cadmium and epigenetics. So that means the epigenetic pathway in the no matter liver and kidney that is plays the same role, make the tissue and the cells really have the sensitivity change. If you have a second hit, and very easily become the cancers. And is that like a methylation or change is really related to cadmium? So this study gave the the mice treatment for the like you see, and high cadmium pollute the rice and to treat the animals. And they also gave the that is a high cadmium pollute contaminate the rice. And meanwhile also gave the EDTA. We know EDTA is the heavy metal chelator can remove. So you can see this one is the normal mice. This is a mice and have eat and eat the here. This is control the red and the blue is filled with cadmium contaminated rice. You can see they have a kidney have a significant increase of cadmium. But if you give the cadmium chelator, so this is reduced. And this is the urine. You can see in the urine, and you have a chelator EDTA, they limited from the kidney in the urine. You can see the EDTA really move a lot of cadmium off from the kidney tissues. And this study, and later they found they also shown that the methylation and EDTA can reduce that. So some from the literature, what we learn and is can support our hypothesis or not. And from the literature, we learned the kidney and cancer and in the past 24 years and significantly increased. And Kentucky, and that is a higher rate and even higher than the nationwide. And Kentucky also have very high and air or soil and contaminated. We have coal, we have that is the Appalachians and mountains have also leaking some metals, and so that is probably related to the environmental and metal, and also Kentucky have a lot of the obese and high diet probably also is the issues. So that environmental and cadmium increase that and both in the human and the animals, and so that is really support our ideas and the mechanism that is support the genomic instability and can cause epigenetic and induce the oxidative stress and cause the antioxidant pathway down. So like I mentioned, using high-fat diet is not good model to induce the kidney cancer. So what else? And I think based on my own work, and we think the iron probably is a good one because that how long and more than 20 years ago, I work on the cadmium part, and we work on the iron and look for the iron induced the DNA damage. So we'll compare the ferric salt and with the ferric salt with the this compound makes the complex, and you can see this one this is a pure ferric salt, and the like a white bar, and the bar means the DNA damage percentile. And this complex, you can see the complex dose dependent, significantly higher than the like pure and ferric salt. And because the in ATN they said that the compound easier to stay and like kind of stuck in the kidney and tissues. So that's why they hold the iron and not like quickly eliminated. So that is like also is easily binding the DNA and kind of chromatin. So that is causing increased. And that is used like a BODR and or just like fluorescence staining. And when we look for the DNA and break down like a smear, and you can see this is like a ferrous, and this is a complex. You can see that compare this significantly reduced, because this is the same dose is with here, and you can see this is the far and the more damage compared from the baseline. And this kind of this complex like the salt and the complex, and this like a salt, ferrous salt, and that is a complex. All the ferrous with the NTA class have more DNA damage. And the DNA damage can prevent by methylcyanine, and that is the one protein I work on. And you can see this is the zinc plus the like a methylcyanine. So that is really can prevent iron complex cause the DNA damage. So that is really shown the evidence in the animal model, like the cell culture work and the cell-free model is that like true, but is that ferrous NTA complex induced like kidney cancer? So you can see this is like a good publication support my hypothesis, and that is shown. You see that is not from NTA, that is 0, but it is like that complex. You can see the very high constant and become the kidney cancer, and that also shown the gender difference. Female very less, and you can see that not that many, and renal cancers. So this is like they use like a 2-hit, and like in the liver cancer part, they use the DNA plus the complex, and they also try to use a curcumin, and that is a natural product, and that is have antioxidant function. So you can see that if iron NTA complex, they can cause 7 become the cancer from the total 20 animals. And if plus have a first hit and plus second hit as the ferro complex, and a significant increase 16 and become cancer. And if you use a curcumin and prevent, and that is significantly reduced. So that is a very like a support our idea, and like we have a cadmium preheat, and like and we can have second ferro and NTA complex. Our hypothesis is that prenatal and exposure for cadmium, like the plus and result, and they change the genomic instability. They are change the epigenetic, makes the methylation change. So that makes the offspring, they show the different pattern, different sensitivity. The red is like a with cadmium mom and like a pre-exposure. And that if we give the F like a ferrous and with like a complex, that this group probably very less become the renal cancer, and this group is supposed to be very high. And if we give a hepatitis treatment, probably that can accelerate. And if we give the zinc, and like that probably can help and to induce. Or if we make that zinc deficiency, that probably increase the incidence too. So that is where we explain our like a 2-dose model. This one, 5 ppm, you see the synergy effect. Actually, that is a acute toxic effect. That is not like immediately become cancers. But this the small dose and even do not show the acute toxic effect, but actually they were hiding some mechanism, shut down the apoptotic pathway, shut down the make the genomic instability to like a kind of repair mechanism shut down. So that will increase cancers. So we try to apply the pilot project in the UofL the EHS center project, and I haven't got an answer yet. And we also try to work with a clinical collaborator, try to collect the kidney sample to measure the trace element and to see what's going on. So that is my the project from previous, and try to the next step. What is the work in progress? And this is a lab member, and you can see some people here. And this board is the student. They work on the previous published work. And Jimmy Yang and Madhuri, they are working on the kidney, and Jimmy Yang work on the livers. And Dr. Yitan here, and Jason is here, and the new student. We have other collaborator. So this is the colleague I want to thank, and also the foundation. And the last, more important for you, and that is your, so you need that. So I would like to, our president.
Yeah, I got one question.
Oh, sure, Dr. Kaka.
It's very nice data, and you show cadmium increase renal cancer
sensitivity to become, yeah.
So is it to promote or initiate the cancer? So people who are exposed to high cadmium.
So like I mentioned, that is kind of a first hit that actually just makes your body and kind of enhances the sensitivity, not immediately cell development as cancer. But if we leave the animal further long, you never know. Longer is 6 months, but if 1 year and 1 year and a half, probably there become a lot of the cancer and the individual. So that is a good question, and is that promote or the cause? So I don't know that yet. So that's why I try to use a second hit and kind of accelerate the cancer development. Because if your budget you have enough money, you can keep the animal for 2 years. That's a lot of money and a lot of budget. So we want to short the procedure and your cycle
So you showed that cadmium activates TNF-alpha pathway.
Yes, correct.
That's the only mechanism cadmium does, or there is other tumor?
A lot of pathway, and that is we pick up that pathway, and with methylation array, we found that pathway and clearly shown. And other change we haven't linked very well yet. So there's several pathways.
So the cadmium is mainly coming from water or the food in Kentucky?
In Kentucky, and actually that is from the soil, I think, and from the we have a lot of coal. We have mountain have the rocky, and different kind of rocky have different metal and accumulate. And we got the year is not that great, and that kind of deposit from the water and from the land. So right now we are trying to work with a main campus, and there Dr. Menhari, and he work on environmental, look for bird and look for soil, and we try to measure the metal from the different part of soil. And with Chris State, we work on the wastewater and strain and to look for which area they have a wastewater have contaminated. That originally they start for the COVID-19, because if that detected COVID-19 high, that means that area, because they can trace where the water come from, now the neighborhood probably got contaminated. But right now the COVID-19 not that many, and we are working on the metal part and to see which have metal contaminated and from the and we are trying to look for that.
Okay. Oh, thank you.
Thanks for the question. How to look for with chat and to see if you have the other question. Chat to see. Okay.
I can say that from the chat,
I got that, Dr. Yeah, someone asked me if I have some information regarding the human curcumin have a benefit against cancer. I think curcumin against cancer, that a lot of publication for that. humans, and different kind of curcumin probably have clinical trial. But I didn't work on the curcumin, so I don't know exactly. But when I read the literature and in my mind, and they have a lot. And the second question is, does zinc have toxic effect in light of the zinc? Zinc and like this, when I explained the metal, zinc is a trace element. Trace element, that means in our body you have to have zinc. But too low zinc deficiency, that is showing the bad effect, right? But too high also like cause the toxic and always. So that kind of is U-shape. It's not like a heavy metal. Heavy metal is should be linear that shape. So for zinc, if too high, and I don't know what they ask is very high or like a middle in the normal range, but zinc cannot be. Zinc is compared other metal is a very big window, like a dose window for the safety. Not like iron or copper, very narrow, and even they request, but the dose level change very small. But zinc is very wide, and zinc also is water soluble. So that is if our body do not need that much, and they eliminate by from blood to kidney, and so they won't have a acute toxic, but more safe than other metal. And I think being considered the immune booster. Yeah, that's true, because zinc is a trace element, a lot of enzyme and like immunocells and even cells of wild cell cycle need zinc. So that's true. So zinc also induces metrocyanin. That is a good inducer. Short protection.
So to add that, since I'm working in cancer research for several years, there are several reports about curcumin in preclinical trial. It works very well, and a number of clinical trials have been on the way or have been performed with curcumin,
Yeah.
but really have not shown any great beneficial effect of curcumin to suppress tumor growth.
But like for me, for the curcumin part, and I know that is good, but that is like not very stable in our body, and so you have to use a lot big dose to reach the level kind of protection. But that a lot dose make your human become yellow, and your like the smell also is not that good. So a lot of people try to modify and the structure, because that have one structure in the middle, and it's easier to degrade by liver enzyme to work on that part. So some group try to like delete that part and change the structure more stable in our body. So in that case, you don't need that high dose go to the intake. But it's not my own work, but I just.
Yeah, that's right.
Thank you.
So in those maps that you showed initially, so things were changing, so that overall, are the cadmium levels changing in different parts of the country?
I didn't show that. Yeah, we have like one slide and like shown, because Dr. One is in the like a junior faculty working in the public health, and she started working on cadmium arsenic in Kentucky for the breast cancer and colon cancer. And in the Kentucky, they really have some county very high, and some county not that high. So she also tried to work on the like a diversity and disparity. Why in the Kentucky is that high average, but still have that like that clear like a difference, and some probably location near Appalachia or some area near the like a manufacturing, and we have some metal factory in the river side, you know that, and also they have some core, and probably they have a location difference. So that's a lot of questions to answer that. Yeah.
So now they track like people who are living there and move to a different place.
That is more complicated. Yeah. So right now is the very beginning to think about the environment because of the diversity and disparity. So they really just start need a lot of work. Yeah, human migration will make it more complicated, not that easy to trace back, especially the environmental. It's not one day. If you leave, someone just move in, even you have 30 years and contaminated, but new move in probably won't have that issues. So it's difficult. We try to collaborate with the geography department and the Charlie Zhang, and we try to do that EPA date and the CDC date to match. And if there are like a high frequency state or low state, they match with contaminant or not. But that is based on EPA is not direct measure your soil, direct measure your water. They just based on you have how many manufacturing. They report each year they how many junk released to environment. So based on that, have calculation. So if we found the match one, we decide to go to soil water to detect, to really measure that. And if we found that further match, and we go to the neighbor problem, ask them, did your vegetable come from the local area? And in that case, probably your vegetable, your food, and got contaminated. So we can step by step to make the link to see what's going on from the association. Epidemiology, the database, they always keep the database big, but they do not answer how the diversity. They just try to give you a convince, oh, 30 cases, just a trend. 300, oh, significant difference. 3 million, no, significant difference. But that is only the overall information and not answer why can he high, why one county is higher than another county. So this environmental really probably in the future can answer that question. Thank you.